Today we're going to be presenting about asthma. We've got our main patient, 11-year-old Bobby, who has just recently been newly diagnosed with asthma, and her grandmother, who is her legal guardian, who is 70 years old, who she lives with, who has poor health literacy, and we'll be educating her today on how to take care of her asthma. Now we are going to go through and tell you what each one of us will be explaining.
Hi, my name is Maliki. I'm a student nurse. I'll be discussing disease pathophysiology to Bobby and Grandma.
Hi.
Is this your grandma?
Oh yeah, this is Grandmama.
Hi, Grandma.
Hello.
Bobby, you just got diagnosed with asthma. Do you know what asthma is?
I don't really.
So asthma affect us as human, and it actually affect our breathing system. So what happens is, for us human, our breathing system is more like a tree. It branch out below the chest, where those two, we have two tubes, one go into the right lung and another one go into the left lung. So what happens, those two help whenever we breathe, it kind of we're taking oxygen, it's kind of supply oxygen into both lungs and exchange it and supply the other part about it. So what happens to just is more constrained because it's caused by mucus production, swallowing in those tubes. That can help make you to not breathe better because it can really squeeze them. So what this causes, it make you, it causes you like it causes you lightheadedness and sometimes shorter breath. Like it make you a little bit blue due to oxygen not going to that part of the body. So what's gonna happen is the doctor will order your medication are gonna help you to open this airway. So those airway gonna be right now it might seem like this, but as you take this medication, like an inhaler, it's gonna open your airway, or make you more to breathe better, and kind of make you breathing more effortless. Yeah. So I'm gonna have another nurse come over to tell you much about the medication, what it is, and how to take it. Okay.
Okay.
Hi, my name is Sophie, and I'm the student nurse who's going to be going through the asthma treatment and medication to Bobby and Grandma. How you doing?
I'm good.
Okay. Hi, Grandma.
Hi.
Okay. So today we're just going to be going through, I'm going to be showing you what your medication that the doctor has prescribed and how to properly use it. So this is albuterol. It's a middle dose inhaler. Okay. So what this medication does is it's gonna help to open up your lungs, kind of enable you to breathe better and deliver that oxygen right into your lungs. So the medication comes like this. This is the actual medication.
Oh.
Right. And this is the canister that kind of holds the medication in place. So, and this medication, according to your doctor, you're gonna be using this every 4 to 6 hours as needed to relieve those symptoms, okay? So, how to use this medication? We're gonna be uncapping this, okay? And since it's actually new, I'm gonna go ahead and prime it because it's new, and you're gonna always prime it too if you don't use the medication for like more than 2 weeks. And actually priming is just kind of like releasing a little squeeze of the medication out, like 4 times. So we're just gonna go ahead and shake it well. You're gonna always wanna shake it before using it. And this is the spacer, which is gonna help really deliver that medication right into your lungs. It helps to kind of release that medication, delivers it into your lungs. So you're gonna place this in place, make sure it's secure and tight. And before you use this medication, you wanna be sitting upright or standing, okay? And so you're gonna tilt your head a little bit up and breathe out as much as possible.
Should I breathe out through my nose or through my mouth?
Through your mouth.
Mouth,
Yeah,
okay.
you're gonna breathe out completely. And then you're gonna place this, making sure that this canister is upright. You don't want it like this, or so it's standing upright. And then you're gonna place that between your teeth and securely hold that with your lips, making sure that your tongue is not in the, blocking the space. Now you're gonna press one puff. And take in a slow deep breath. Right? Hold your breath in place for like about 10 seconds. Then slowly breathe out. Okay? And because your doctor has prescribed 2 doses of this, you're gonna wanna repeat that the second dose, but then you have to wait 1 minute between each dose. Okay? Alright. Okay, Bobby. So now it's your turn to show me how to use this, because when you go home, you're gonna be doing this by yourself.
Okay. So I have my applicator,
Okay?
and I'm gonna take the cap off. I'm gonna shake it,
Cool.
and I'm gonna put this on, nice and tight,
Okay.
and then I'm gonna breathe out.
Okay, now you wanna make sure you're standing straight and upright.
Oh, upright,
Good.
okay. And now breathe out, and then push it and breathe in.
Okay. Making sure that your mouth is securely tied and holding that spacer in place. Okay, so
How did I
after
do?
you did actually good, but just remember when you press down and take that slow deep breath, you're gonna hold your breath for how many seconds?
5,
10 seconds.
10 seconds, 10 seconds. Okay.
Yes, I think Grandma can remind you about
Alright.
that. So you're holding your breath for 10 seconds, okay?
Okay.
Before actually breathing
Breathing out.
that out.
Okay.
Correct. That was good, Bobby.
Thanks.
Okay, Bobby, this is some very important things that you need to know. So because of your disease, you know, you can always have those chest pain and difficulties breathing at any time. So you wanna make sure that you have your inhaler with you at all time. You wanna also have your school, have one inside, you know, just in case you have those exacerbation and those symptoms. Then you can have your medication in place, okay? And then some of the symptoms, maybe side effects, I mean to say. Some of the side effects that you need to watch out for, like maybe unpleasant things that you start maybe feeling or noticing during the use of your inhaler is gonna be shakiness of your hand. You might feel a little trembling of your hand and feet. You can have maybe increased heart beat. So yeah, but if you ever notice anything like very uncomfortable, you wanna call your doctor, okay? And so I'm just gonna go ahead and hand you this manual for you to refill back to with everything we've discussed today. It has the cleaning, how to clean your device. So what you're gonna be doing with this every week, at least once a week, you're gonna be washing this with warm water and a mild soap, okay? And then rinse it properly with clean water and just air it dry, okay? And I think that's just it basically. Is there any question for me?
Yeah, I guess I have one. When do
Okay.
I know I need to refill the medications for her?
Oh, that's a very good question. Actually, so this medication comes in with like, it has like a number on here,
Mm-hmm.
if you can see. So each time you have that puff, it kind of, the number decreases. When it goes down to about 20, maybe that's gonna be the right time to call your pharmacy for a refill, just so
Okay.
you don't run out of it, okay?
Okay.
Yeah, I think that was just it.
Hi, my name is Tenzin, and I'll be the student nurse who will explain self/family care intervention to Bobby and Grandma. My name is Tenzin. I'll be the student nurse explaining to you about self and care family intervention. Okay? What it is how we can have Bobby care for herself better, and then how you, grandmother, can care for Bobby better. Okay. So one of the main thing is for your smoking habit. And I know I sound mean right now, but the main thing is we can't have you smoking around her, right? Because we don't want her asthma to get worse or her have to have an attack because of the smoke. So what you can do is maybe go a little bit away from the house and smoke there instead of smoking around her.
Okay.
And never smoke in the house because we don't want that smoke to get trapped in the house and then for her to come later and then, have that attack.
Okay.
And for Bobby, we will be making a weekly schedule where maybe you're empty or you have a schedule empty, and then I'll come and I'll
It's
be
an empty.
as in you're free during that time.
Oh.
So you have no school or no after school activities, and I'll be there and I'll be going over your medication usage, your peak flow meter, how that's going on, because remember you went over with that, the doctor, and also your action care plan, right? And that you also went over with your doctor, and remember he told you that you're in a yellow zone because you're not taking care of it, right?
Right.
And we want you to be in that green zone where you're managing it without having an exacerbation, which means asthma attack. Okay?
Okay.
All right. And here is your action plan that you created with your doctor. And you can just look over this, and right here it lists all the medication that you need to take if this happens. So we want you to stay away from the red zone. The red zone is bad, and that means that you're not able to manage it at all. And then these are the medications that you'll be using if something like this happens.
Okay.
Okay?
Hi, my name is Anne. I'm a student nurse, and today I'm going to be going over community resources with Bobby and her grandmother. All right. Hi, Bobby. Hi, Grandma.
Hello.
I'm here today to talk about some community resources that can help with Bobby's newly diagnosed asthma. If you wouldn't mind just turning your eyes to this computer screen right here, we're on the Minnesota Department of Health website. And as you can see, there are just programs beyond programs of things that you can click on, interactive things that will help education on medication and treatment, on the peak flow meter, on the zone, what zone she's in, lots of helpful resources right here through this website. And I also wanted to mention a program called MAP, which stands for Minneapolis Asthma Program. And how it works is that you're going to give this phone number a call, and the city will send somebody out to your house to make sure that your house has the best environment for Miss Bobby and her asthma needs. They check your air ducts, they check ventilation systems, they do everything just to make sure that the air that she's breathing is quality and good.
Okay.
Do you guys have any questions at all?
I was just wondering, do we have to pay for those services?
No, so everything listed on here is going to be completely free for you.
That's
And
nice.
this MAP program is completely provided by the city because you live within Hennepin County.
Okay then. All right.
All right, thanks you
Sounds
guys.
good.
Yeah.